Hello, are you someone who's suffering with a movement disorder, a Parkinson's-like condition? Maybe it's actually diagnosed as Parkinson's. Do you have any kind of tremor disorder where maybe the fingers are moving on their own, involuntary movement of the fingers? Or have you noticed that when you walk, or maybe a loved one noticed that when you're walking now, your arms don't swing by your sides the way they're supposed to when a human being is walking? We should have a nice strut or swinging of the arms by our sides as we walk. I'm going to show you in this video of a patient who has had tremors in the hands, who has had a difficulty or inability to properly swing both of his arms when he was walking. So I'm going to show you that video, and as well as go over the test findings that help bring him to this point in his first re-examination with me, and help you really understand that there is a way that you can find and safely remove the chronic hidden infections and hidden toxins that are causing your body to malfunction. My name is Dr. Lonnie Herman, and in this video, as I just said before, you're going to see the videos and you're going to see the change from before and after treatment, and you're going to hear this man discuss exactly how much better he is feeling, and even his caretaker, a woman friend of his, who has noticed dramatic changes for him in this first protocol with me. Now, the speed of recovery is from patient to patient. Not everybody heals at the same speed. But with this man, it's such a great outcome. We have to show this information here. So let's take a break and look at the initial video when I first examined him. You're going to see his hand tremoring. You're going to see on both hands, you'll see them, the index finger moving on its own in one, on the other hand.
Sometimes it's worse than other time.
Yeah, sometimes worse. So that finger, sometimes it could just be the finger, sometimes the whole hand.
Whole hand.
Right hand, and you're not trying to make that happen. That's just it doing it. Yeah, that's it. Yeah. And but sometimes it could be. There's the tremor again. And now after, he followed unique steps to remove the primary hidden neurodegenerative disease-causing agents from his tissues, which were discovered in his first exam. So that's the right hand. Mr. Benjamin, we see you. That's your right hand. And I'll take a zoom in here. I see no movement. I'm going to move this head out of the way. It's a little reflecting here, but I see no movement in the fingers at all in that right hand. Take it from this angle. No movement at all. Come over here to the other hand. You know what? Maybe if you take your fingers and just let them drape over the end of the yeah, just come forward in the front. Yeah, just let them hang over, just like that. Yeah. And so we'll look to see that hand without it, that finger without it touching anything. Let me stop my shaking. No movement. Yeah, I consider that phenomenal. Look at that hand, no movement. And we'll compare that to what we did. Now, prior to his first protocol, let's observe his gait pattern. Notice the arms not moving. The left arm swings a little bit. Okay, come on and turn around this way. Come on and walk back towards me. Yep, come on back. Now the legs don't swing all the way. Slow walking. You don't see the right arm move. You can actually, looking close, the right hand is tremoring some. Left arm slight swing. And there we go. And let's go inside there. And now we can easily appreciate his improvement in his gait. Notice 1, stronger walking, 2, faster walking, and 3, much greater arm swing during his stride. Arm swing is a lot better now. You can turn around and come this way. Arm swing is a lot better. Look at the hands moving by those legs. Come on past me. Just keep walking that way. Look at the arm swinging. Both arms are swinging now. Come on back this way. We see the arm swing. Yep, come on back. Keep moving the way you're moving. Those arms are moving that they did not move before. Look at those arms move. Excellent.
One thing that Benjamin did say is that he trusts Dr. Holman.
Thank you. So you see without walking now, and again, you can rewind the video and watch the first video of him walking and watch his arms at his side when he's looking for normal stride, normal gait, he's attempting to have normal function, but that one arm is just stuck right by his side. It barely is moving at all. If any movement can be noticed at all, little tiny amount. The other arm moves slightly a bit more than that, but in this new video, you could see both arms are moving just about the way they're supposed to, but much greater arm swinging, which is the normal human being locomotion with the arm swing when we're walking. The arm is always supposed to be swinging when we're walking. Well, let me describe some findings with you in this man's, in his first exam and his follow-up exam with me, and then we're going to set into his testimonial video where he's very happy to share the changes that have taken place for him and what he can feel is taking place in his body. When I first met this gentleman was October 5th of 2017, and he came to my clinic from St. Thomas to my office where I'm located now in South Florida. This video, by the way, I'm making this on January 29th of 2018. And what I noticed with him in the first exam with my very unique manual bioresonance method of testing the body with an understanding of the way the functions of the different parts of the nervous system are supposed to be, the different parts of the nervous system that regulate our movements, as well as the function or the connection to our spine and our brain with our various blood vessels, and the understanding of the way that our whole body works together with the various organs and our glands, and the understanding that you can have disorders take place when there are infections and toxins that get into our tissues that can cause a change in the dopamine expression or the GABA expression or any of these brain chemicals. I took extensive studies in neurochemistry and immunology it's been 11 years of postgraduate studies, and we've got to be able to put the pieces together to understand what causes the chronic disease and use a different type of science that can help us remove those safely, pinpoint and safely remove those chronic hidden infections and toxins that are causing the malfunction of our nervous system. And again, speed of recovery is from one patient to another. Keep that in mind. So in his October 5th of 2017 examination, and again, today's January 29th, so I'm seeing him a little more than October, November, yeah, probably 4 months down after his first exam, somewhere around there. I found in his first examination that he had a bacteria, a very harmful streptococcus bacteria in his hematopoietic stem cells. These hematopoietic stem cells are the cells which produce red blood cells, white blood cells, and platelets. Now he has a slightly bit higher than normal platelet level in his body, so we're going to be going after a bit more of that within his stem cells, which I'll talk about in the next exam, his follow-up exam. That was today, January 29th of 2018. But I also found various chemicals, insecticides, and pesticides in his hematopoietic stem cells, and the need for those hematopoietic stem cells to be able to get more oxygen in and carbon dioxide out. So we've got to be able to get those tissues, those cells, to breathe better so that they can actually help us regulate our blood, red blood cells, white blood cells, and the platelets. I found Clorox, residues of Clorox bleach in his large intestine. I found a bacteria called Treponema bacteria in his large intestine. I found chemicals from Zephyr Hills water. Zephyr Hills is a natural, so-called natural spring water, and I have found, without giving you the whole list of the toxins I found in there, pesticides, arsenic, lead, various chemicals in these waters that are just not safe. So you don't know where the water's coming from, and you trust to buy the natural spring water. You just don't know what's in it if you don't have the ability to test for it. I also found in his small intestinal tissue the same Treponema bacteria and the same strep bacteria and some other parasitic flukes in his small intestine. I found up in the brain, there's a tissue in the brain that helps regulate smooth movements to be able to control the limb so we're not having interrupted jerky movements. The globus pallidus, it's called. Globus pallidus is a tissue that helps to regulate smooth movements. Okay, so what happens when the globus pallidus can be infected and toxic? The ability of the individual, once it reaches a certain level of toxicity or infection in this tissue, it can cause that tissue to not be able to regulate a smooth movement with the body. So we can have jerky movements and involuntary tremors or involuntary, what's called very athetoid movements, where the fingers are just moving on their own, where it's not really a tremor, but the fingers just they wiggle around on their own and somebody can't control the limb. It can even happen with the jaw, where the muscles of the face are athetoid, uncontrollable movements there. I found in his globus pallidus plastic chemicals. How did that get there? Well, drinking bottled water that's in plastic bottles. What about having sandwiches that are wrapped in plastic? What about plastic that could just be in the water that you're getting in your home that maybe you drank 20, 30 years ago and the plastic is in the body? So we can absorb plastic chemicals in our body. It's one of the most common toxins found in the human being in the globus pallidus, Lyme infection in the globus pallidus, bacteria and parasitic infection in his globus pallidus, causing that globus pallidus to not be able to perform functions appropriately. I also found his frontal lobe of the brain. You've heard the right brain, left body, right brain, the frontal left brain, right body. The frontal lobe has motor control as well as cognitive, as well as part of the memory function in there, and some other functions. We don't have to get too detailed into this in this video. His frontal lobe had bacteria parasitic infection. The thalamus of the brain that helps to fire the signals up to the whole cortex of the brain for the brain to know what to do. I'll put an image up here of where the thalamus is in the brain so you become a little more familiar. As I say in other videos, as human beings, we're not born with the owner's manual of the human body, so you've got to learn somewhere so you know what needs to be done for you, you know the right thing. I found various bacteria in his thalamus. I also found a serious viral infection in his globus pallidus as well. He took that protocol, as well as, I'll show you pictures right now, before he even started this protocol, I sent him off to a dentist who I've worked with before, who can follow some steps that I want done for people, a biological type dentist. And this man, which I'll show you the pictures now of, teeth in his mouth, he had these horrible infections in his teeth and metal in his teeth. And I'll actually show you a picture of what each tooth looked like when it was extracted from his mouth, or maybe I'll show you just one of them because you can see there was a big chunk of metal that was on side of one of these. And the metal can get into the brain, the infections from the teeth can get it right up into the brain and make the brain malfunction, causing brain malfunction. Well, those teeth were pulled, and while the patient, you'll hear him in his testimonial video, that he felt psychologically, he felt better, but there was no physical change just from having these teeth extracted from his mouth. When he came back, he told me that halfway through his protocols, when he started to really notice the physical changes, arms swinging and the fingers, he's got much better control. He's not perfect yet, but he's got much better control of his limbs, of his fingers and his arms now than he had for the past 3 years of living with this uncontrollable movement disorder. I found with his follow-up examination today, in the cortex of his brain, I'll tell you, there's a chemical that I found, and I'll put some information up next to me here on the screen. There's a chemical called Versed. It's a sedative anesthesia chemical. Understand something, anything that goes into your body, whether it's through a medical procedure, whether you ate it, whether you smelled it, whether you somehow put it on your lotion on the skin, chemicals can get into the body in various ways. Infections can get into the body in various ways. Just because somebody had a medical procedure where they put somebody to sleep, the sedative does not leave the body. Maybe some of it does. Maybe some of it doesn't. It can cause, these sedatives can cause, these anesthesia chemicals are actually linked to dystonias, tremors, and these athetoid movements, because they can cause toxic effects that can damage the function in parts of our nervous system. And if you can just think of, with an analogy of a shirt like a tie-dye shirt, let me put a picture up of a tie-dye shirt next to me. For those of you who may not know what a tie-dye shirt is until you see one, well, we take a shirt that's white, tie a knot in it, maybe tie some rubber bands around it, dip it in water that has some like red dye in it. When you take it out, it's going to be a red tie-dyed t-shirt. Tie it up again, dip it in water that has a green dye, and it's going to come out with some areas that are green on that red and now green tie-dye t-shirt. The shirt that was white, when it's got the red and green dye in it, you put it in a washer and dryer, the dye does not come out. Maybe a little bit will come out in the wash, but it's still going to be that red and green colored t-shirt now. It's no longer white anymore. Understand from that simple explanation, the one time that that dye went in the shirt, it stayed there. It's done. It's it. What happens when these anesthesia chemicals can get into parts of the brain that make dopamine, they can cause such sedation of the tissue where the tissue can't make the dopamine in normal levels. If you're just going to follow the dopamine deficiency causing movement disorders explanation, if you want to just Follow that. Understand that a sedative chemical that stayed in the brain can actually keep the brain tissue sedated to a certain degree. Even though you're wide awake and walking and talking and doing whatever you're doing in your life, the sedative chemical can actually lead to the brain not to be functioning normally. Well, I found this sedative chemical, Versed. I found this in his cortex of his brain. I found it in, here's another one where I found it in his kidneys. I found it also in his other brain tissue. I found the Versed in his stem cells, the hematopoietic stem cells, which are the cells that make the red blood cells, white blood cells, and platelets. Could it be that those hematopoietic blood cell producing stem cells in his bone marrow are not able to function appropriately? They're having a malfunction and they're producing too many platelets because there's chemicals in there that are not making them work right. I mean, if you drug up an employee in a factory, will the employee work normally? Probably not. I also found the Versed in his substantia nigra. The substantia nigra is known as it's got cells that are known to produce dopamine. They're highly dopaminergic or dopamine producing cells in this substantia nigra of the brain. Now further, I found those extracted teeth that I showed you. I found those extracted teeth. I was able to match those up to specific parts of his body where there's also dopamine made and other parts of the body that help regulate blood pressure, because blood pressure and normal blood pressure is important for brain function. So a tremor or movement disorder can be in part related to a blood pressure disorder, whether it's low blood pressure or high blood pressure. I found that those teeth that were extracted, poisoning and infecting the retina of the eye. Now, he's had cataract surgery. He still has a cloudy appearance in his eyes. Well, I found today by doing a specific eye test with a light reflex in his eye test, I found that the retina is invaded with these infections from these two and the chemical that's in the tooth from these two extracted teeth. I'm making remedies to get those out of the retina. Understand something about the retina that you may never have heard before, except maybe you're hearing it from me on some of my videos here, is that the retina has cells called amacrine cells. These cells are highly dopamine, they are cells which produce dopamine at a high level. So what would happen when the retina has some infection or toxin in it, or both infections and toxins? What's going to happen to the ability of these cells to produce dopamine? Do you think it's going to go up? Or is it going to stay the same as what it should be? Or is it actually going to go down? Any infection, if you've ever had an infection like a sore throat, your ability to swallow goes down. Your ability to speak probably goes down. Your ability to sleep may go down. When we have tissues that are infected and inflamed, the production in there, maybe it's going up or it's hyperactive, but very often it's going down. So what's going to happen to these amacrine cells in the retina when they're infected from these teeth? What's going to happen is most likely their ability to produce dopamine has gone down. So the brain function goes down. I also found those dental infections in the cerebral cortex. Those teeth matched in his cerebral cortex. I also found those teeth infecting other parts of the brain. I found them infecting a part of the brain called the red nucleus. The red nucleus is a part of the brain you'll see next to me. It's also important to have bodily control. The brain has to send signals through this red nucleus we've got to be able to have communication through specific parts of the brain. That's all that you really need to understand. What happens when certain nucleus sites, what happens when certain parts of the brain have infections and toxins in them? They can't function normally. I also found that those dental infections, those teeth infecting his liver, which is really important to help cleanse our bloodstream, what's going to happen, and have normal hormone balance and part of the blood pressure, what's going to happen, and digestion, what's going to happen when the liver is infected and toxic with dental infections. You can run a blood test like a genetic study. You can run a test on the methylation gene, if you've heard of that one, and get on B vitamins. But when you've got certain infections that are in your liver, how is the liver going to function? You got to get rid of those infections. You got to be able to find them and safely eliminate them to see the kind of recovery that we just saw. Everybody heals at a different pace. Remember I said that. I found those dental infections in his kidneys. I also found those dental infections in what's called the thalamus of the brain. I found that the thalamus can't fire the way it's supposed to tell the other parts of the brain what to do. And we have a whole cascade or domino effect. When these tissues are infected, we can't make enough dopamine. We're having inflammatory responses in the brain, in the liver. Digestion is not right. The brain can't breathe appropriately, literally, even though he's breathing and he's not blue in the lips and blue in the face. What's going to happen when these tissues are so infected and toxic with sedative chemicals? What's going to happen? They're not going to work well. And that is the understanding that we have to have. After extensive studies in neurochemistry and immunology, I learned one thing, is that drugs are not going to prolong, let me not put it that way, drugs are not going to improve the function by improving the parts of the brain's ability to make the certain chemicals. And nor will vitamins, and nor will certain herbs. What we've got to do is get in there and clean out the tissue. And the unique kind of bioresonance method that I test, I can listen into those tissues, find the chief causes of their disorder, of their malfunction, the infections and toxins, and we can provide safe and effective remedies that will clean them out. It's all about frequency-based remedies, and I'm going to tell you something here. You can listen to this quote from a brilliant man. You probably know him, Albert Einstein, and you're going to read this quote here on the screen, and I'm going to read it to you right now. As Albert Einstein once said, everything is energy, and that's all there is to it. Match the frequency of the reality you want, and you cannot help but get that reality. It can be no other way. This is not philosophy, this is physics. Frequency to match the frequency of what you want. When we can actually match up the tissues that biophysicists discovered, the frequency of the tissue, the infection, the toxin that's driving the tissue to have a malfunction, we can get in there and start to boost the function and clean it out. We can see positive physical changes. Sometimes there are aggravations when the body is cleaning out an infection or toxin, but in the end, it's only going to make the person healthier and function better. So let's watch the testimonial video in full. Listen to this man. He's pretty happy, talking about a dramatic change that he's experiencing already. Again, rewind this video, look at the changes that you see before and after, and I'll come back in just a moment. Your body function, the hand, the finger, hand tremor, and the arm swinging, if we could call that, or the lack of swinging, if we would say 0 is no problem and 10 is a serious problem, for you in the way that you were malfunctioning, what would you call it? 0 to 10, if 10 is the worst for you?
I said a 7.
You are at a 7?
Yes.
Okay, and if we were to say it now, what are you down to? How, do you feel better?
Much better.
Much better. How much better do you feel? Can you give a percentage rating?
I would say about 80, 90.
80, 90%?
90%.
And what do you think about him?
Yeah, I'd say about 70%.
70% better, 70% better with a hand less tremoring?
With a less tremor.
Still is there, but it's not perfect yet, but it's
Yeah.
70% less. It's happening less
Less.
often,
And he's walking stronger.
walking stronger, and the arms are moving.
Sometimes it's worse than other times.
Yeah, sometimes worse. So that finger, sometimes it could just be the finger, sometimes the whole hand?
Poor hand.
Right hand. And you're not trying to make that happen. That's just it doing it. Yeah?
That's it. That's it.
That's it, yeah. But sometimes it could be. There's the tremor again. And now after, he followed unique steps to remove the primary hidden neurodegenerative disease-causing agents from his tissues, which were discovered in his first exam. So that's the right hand. Mr. Benjamin, we see you. That's your right hand. And I'll take a zoom in here. I see no movement. I'm going to move this head out of the way. It's a little reflecting here, but I see no movement in the fingers at all in that right hand. Take it from this angle. No movement at all. Come over here to the other hand. You know what? Maybe if you take your fingers and just let them drape over the end of the yeah, just come forward in the front. Yeah, just let them hang over, just like that. Yeah. And so we'll look to see that hand without it, that finger without it touching anything. Let me stop my shaking. No movement. Yeah, I consider that phenomenal. Look at that hand, no movement. And we'll compare that to what we did back when I videoed this in October of 2017. This is January 29th of 2018. Now, prior to his first protocol, let's observe his gait pattern. Notice the arms not moving. The left arm swings a little bit. Okay, come on and turn around this way. Come on and walk back towards me. Yep, come on back. Now the legs don't swing all the way. Slow walking. You don't see the right arm move. You can actually, looking close, the right hand is tremoring some. Left arm slight swing. And there we go. And let's go inside there. And now we can easily appreciate his improvement in his gait. Notice 1, stronger walking, 2, faster walking, and 3, much greater arm swing during his stride. Arm swing is a lot better now. You can turn around and come this way. Arm swing is a lot better. Look at the hands moving by those legs. Come on past me. Just keep walking that way. Look at the arm swing. Both arms are swinging now. Come on back this way. We see the arm swing. Yep, come on back. Keep moving the way you're moving. Those arms are moving that they did not move before. Look at those arms move. Excellent.
One thing that Benjamin did say is that he trusts Dr. Holman.
Thank you. Thank you.
So because of the trust factor also, the faith that he had when he believed in the remedies and the natural, you know, that makes it better.
Excellent.
It's work better.
Excellent. Thank you both. Isn't that wonderful? What he and his friend, his caretaker friend, have just said, have just shared with you. It's incredible how much better he's doing. Incredible. Now, you can share this video with a loved one. Just one person, share this and let them see and let them judge for themselves. You can find and eliminate these infections and toxins from the tissues and start your recovery process. And I can help you do it. Share this video. Like me on my Facebook page. I put up information there on a regular basis. I've got a lot of posts on my Facebook page that you can scroll through and just look through and read different things and videos I put up. You can follow me on Twitter, follow me on my Instagram, on LinkedIn. I've got information there that I put up sometimes, as well as subscribe here on this YouTube channel. On my YouTube channel, I've got a lot of different videos talking about these chronic diseases, as well as not just Parkinson's, but there are other disorders that I work with. So watch some other videos that I put up here. I'll put some links to certain videos about Parkinson's below this video. Watch these other videos and get a better insight, a better breadth of understanding of how the body functions and the tissues that we need to understand and look into that could be causing the disease. Also, after you subscribe to this YouTube channel, and the reason why you subscribe is because you can get an email, you'll be one of the first people to get an email when I put up new videos here, okay? And then you can call my clinic and you can set up an appointment with my friendly, lovely clinic assistant. She's happy to help you set up your first appointments with me. The number here is 954-370-3100, 954-370-3100, and you can also send an email to her and she can help you arrange your appointments with me. I want to tell you, number one, insurance companies don't favor this kind of work. They don't recognize my kind of work. They're not going to pay for their services here. So this will be an investment in yourself that you'll have to work that out with us, okay? Number one. Number two, people do travel to my clinic from all around the world. It's from across the United States to my clinic that's located here in South Florida right now. People have traveled as far as Thailand, New Zealand, Italy, United Kingdom, Canada, Venezuela, Mexico, Russia, China has come into my clinic for the kind of work that I offer. So it's not too far for you to start to make the right steps. Belgium, Norway, Netherlands have come in here for my work. So it's not too far. You can make it in, you can get started, and I can help you on your journey to start getting better. You might have more infections and toxins to clean up in your body than the next person. It may be one major piece that's going to be the big pivotal piece that's going to help make a change in you, or it may take several treatments. We don't know that, and there's no way to predict that. Okay, call my clinic at 954-370-3100.